Well, Danny, February is a special month for us ladies.
Yeah, Claudia, that's right. February is American Heart Month, and heart disease is the #1 killer, actually, of women in the United States. So to better prepare us as women to ensure we have cardiovascular health, I sat down with Dr. Kohli, our favorite cardiologist. All right, everybody, February is a very special month in the cardiovascular world, which is why we are bringing in our expert on all things cardiovascular, Dr. Kohli. Thank you so much for being here. Hi.
My pleasure.
Yes.
This is my favorite month of the year.
I was going to ask, okay, so tell us about February. What are we kind of celebrating this month?
Well, you know, we celebrate love, which obviously comes from the heart.
Of course.
But what we also have to celebrate and really raise awareness of is heart disease in women.
Yeah.
And this is why the American Heart Association several years ago launched the Go Red for Women campaign.
Yes.
So February 3rd is the day that every woman should wear red and every man should wear red to raise awareness of heart disease in women, which is the #1 killer.
Wow. Okay, so this is something we need to be looking out for right now, too. What are the biggest things to keep in mind during Women's Heart Month? What do we need to be thinking about? What do we need to be cognizant of?
I would say a few things. So first, as women, we feel heart pain differently than men. And so sometimes we don't realize, and this happened to my aunt actually, she went out to lunch with her friends, started having some really severe heartburn and nausea, and thought it was from the Thai food that she ate, and actually she was having a heart attack.
Oh my goodness.
So we feel heart pain sometimes as heartburn, as kind of discomfort in our chest that might be more subtle.
Right.
We might actually just feel tired or fatigued. It's not necessarily the classic symptom which often happens in men, which is, you know, pressure, heaviness, or an elephant sitting on their chest.
Sure.
So that means our radar has to be up for, you know, heart disease symptoms. So if we feel any kind of unusual discomfort in our chest, some nausea, sweatiness, something that feels off, just have a very low threshold to set off that alarm bell in your head that it could be related to your heart.
Excellent.
So that's the first piece of it. The other piece of it is there's a gender gap and a disparity when it comes to heart disease in women. And we as women and have the men in our life close that gap for us. And what that means is, for the longest time, for the last several decades, even though heart disease has been our #1 killer, you know, we've been closing that gap and really improving morbidity and mortality in men.
Oh, wow,
but with women, we're not making the same kind of progress.
Right.
And that's because we don't study women as well. There are biological differences in women that make them higher risk that we don't quite understand, and we're not tailoring our therapies towards women. So as a cardiologist looking forward, I really hope that the next decade is sort of, you know, dedicated to closing that gender gap.
Definitely, and not just a cardiologist, but a female cardiologist.
That's right.
To boot. Okay, excellent. Now, I want to talk about how we can keep up with our cardiovascular health and make sure that we're preventing some of those things from happening too.
Yes, so since we know that statistically we're more likely to die from heart disease than from anything else, prevention is worth a pound of cure.
Yeah.
So this is really important for us to start in our 30s and 40s. So we talk to our granddaughters, we talk to our daughters, we talk to our 20-year-old college grads, and we say now's the time to start checking your blood work, screening your cholesterol, screening for high blood pressure. When we get pregnant, that's the first stress test a woman's body undergoes.
Yeah.
So if we've had any issues with pregnancy, whether related to blood pressure, blood sugar, or even had premature delivery on one of our babies, that's a little alarm bell in my head as a cardiologist that this woman down the line could be higher risk for having heart disease. And then if we have anything that pops up on our mammogram, sometimes we see little what's called breast arterial calcifications. That means the tiny arteries are starting to develop plaque and blockages. That's, again, a warning to us that 20 years later, when we're in our 60s and 70s, the bigger arteries may. So checking our blood work, checking in with our doctor about our family history and risk factors, and really doing it very early and doing it every single year after year so that we know we're staying on our preventive health.
Okay, well, it's never too early to start, and February is definitely the month to think about it. So, Dr. Kohli, thank you so much.
My pleasure.
Well, if you have a topic or question for Dr. Kohli, you can message us on our Facebook page, Colorado and Company on 9 News. Your topic may just end up on the show.